Mr. Jones. My name is Dante, and I'm here to perform some catheter care collection. The urine produced in your catheter bag. I'm going to collect the urine from your catheter bag. I'm going to record your urine output. How does that sound? Wonderful. All right, real quick, what I'm going to do is take a look at your wristband. It is you, Mr. Jones. Wonderful. I'm going to go wash my hands, and I'm going to gather my supplies. I'm going to go wash my hands. And for this, what I'm going to need are 2 barriers. My gloves, and I'm going to need an alcohol pad or alcohol wipes, and I'm going to need my graduate. In this graduate, it appears that there's water or liquid in it, but this is empty. This is what I'm going to be collecting from the catheter bag. So I got my gloves, and now I'm going to come over to my area where I'm going to first prepare the one barrier underneath the catheter bag that's hanging at the side of the bed. I'm going to observe that this catheter bag is hanging from a non-movable part of the bed. I see that it is hanging from a non-movable part of the bed. I'm now going to get my graduate, my empty graduate, and I'm going to place this right underneath the catheter bag. I'm now going to have this other barrier that I'm going to use to put on my surface, my flat surface, so that I can read the graduate once I'm ready to use it. I also have my alcohol wipe. I'm going to real quickly open this alcohol wipe, and I'm going to place this on my graduate on the floor. I'm going to put on my set of gloves. My set of gloves are not on. I'm going to again make sure that when I'm looking at the catheter, it is not kinked. The tubing looks good. The catheter is not being kinked or disturbed by the patient laying on it. I'm not going to kneel. I can squat, but if I choose to kneel, then I should put a barrier underneath my knee. In this case, I'm just squatting right here so I can collect the urine from the catheter bag. I'm now looking and open the shield of the Dignity bag. I'm now looking at the port. I'm going to now make sure that the port is closed. And you'll see that there's this port on the Dignity, on the catheter bag. And this port, it looks like it's a plug. And if the plug is closed, that means when I open this, the urine is not just going to pour out on me. So I want to make sure that it is closed. It is closed. Now that I'm ready to take the urine out of the catheter, I will now open the port. I will make sure that I'm going to place or pour the urine flow into my graduate without touching the sides or inside of the graduate. I'm not going to touch the inside with the catheter port. Now that I've got the urine inside the graduate, I am going to close the port. This is why I have my alcohol wipe that's open. I'm now going to wipe the surrounding of the port. I'm going to wipe the inside of it to reduce the spread of bacterial growth. I will then place that on the on the barrier. I'm now going to put this port right back into the catheter port of the bag, making sure that it is not, again, still attached to a non-movable part of the bed. I can now grab my barrier. I can put this into its designated area. This just goes in the trash. I have my graduate. I place the graduate down on a flat surface. Now, reading it while it's on a flat surface, I see that the numbers here are, like, I look at, there's 200, there's 225, there's 250, there's 275. This looks right there at 250 milliliters. So I'm going to look at the right side, not the left side. This is in ounces. The right side is in milliliters. So I'm going to look at the right side, which is the milliliters, and I'm seeing that it is at 250. So I know how many milliliters to record. I can now take off this barrier. I can throw this in its designated area, whether it be trash or if it's going to be soiled linen. Now that goes in its designated area. I can take this over to the sink. Now, I already know how many milliliters are in here. I can pour this into the toilet. I can get a paper towel, open the faucet of the sink, and then get more water in here, throw that in the toilet. Now, maybe I could do that a couple times, but the water's running. Now I throw the paper towel in the trash, I close it with the paper towel, throw that in the trash, and I get as many paper towels as I'll need to clean or dry the graduate, and I can now put this in its designated area. I would remove my gloves, state sanitize his hands. Now that I have my milliliters already collected, I can just go back into the room. Mr. Jones, I'm just gonna make sure that you're comfortable, your bed's at its lowest position, your call light's in reach. Do you need anything else? No? Okay, I wanna let you know that the milliliters that I collected was 250 milliliters. How's that sound? Pretty good. All right, well, if you need anything, use a call light. In this case, I would go, the one thing I did not, because you don't have to, you're not really demonstrating on a live person per se with the catheter or you emptying it, but I would have stated that yes, I would have closed the curtains for privacy in this case because I brought up that I'm working with an actual patient that's in front of me. So now I'm opening the curtain to unprovide the privacy. He needed nothing else. I'm gonna wash my hands and now I am out the door. Skill is complete.